Good afternoon, Charles Hawkins. Let's begin the warm-up session. Why did you choose to become a nurse?
There are several reasons why I chose nursing. First of all, many of my relatives are nurses, and their stories inspired me a lot. Besides, nursing is a profession with an ocean of opportunities, both native and abroad. Above all, this is a service-oriented profession in which I can serve humanity. Hence, I chose nursing as my career.
Why did you choose OET?
It is my long-term ambition to work as a registered nurse in any English-speaking country, such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence, I chose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals. Therefore, I believe I could perform well in this test.
What are the current trends in your profession?
Nursing is a dynamic profession, and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in the past have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in the present day, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Do you have a role model?
Yes, I do. My role model is my mother. I follow many things that my mother does. It is from my mother that I learned the basics of kind behavior, decision-making, and organizing skills, a polite and humble manner, and a helping and sharing mentality. The care and respect she gives to everyone makes me wonder sometimes. She is a perfect example of womanhood. I believe a nurse should possess all these qualities. She is my superhero.
Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system, and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
Your preparation time is over. Please start your OET speaking roleplay.
Good morning, Mihiraa. I'm Charles, one of the oncology nurses. I can see you're looking a little pale. How are you feeling right now?
Hello, Charles. Honestly, not so good. I just feel really queasy and tired. It's been a bit of a struggle since the infusion started.
I really appreciate you telling me that, and I want you to know that what you're feeling is very common. I'm actually here to do my routine check while you're having your infusion, which involves monitoring you closely for any side effects just like this. It's a standard part of our care. To help me understand better, could you describe in detail what you've been feeling since the treatment started?
It started about an hour ago. It comes in waves. Sometimes it's just a background feeling, and other times it's much stronger and I feel like I might be sick. It's making me very anxious.
That's very helpful information, Mihiraa. Thank you. Managing nausea is a key part of what we do, and we have several options to help you through this. We can give you antiemetic medication, which is an anti-sickness drug, either directly into your foreline for a quicker effect or orally if you feel you can keep a tablet down. Based on what you've told me, it would also be a good idea to note in your file that we should give you a pre-medication before your next chemotherapy session to try to prevent the nausea from starting. To decide on the best approach for you right now, I need to ask, would you be comfortable if I administer an anti-nausea medication for you now 3 or 4? It should bring you some relief quite quickly.
Yes, please. Anything to make this feeling go away. How long will I have to deal with these side effects?
I wish I could give you a definitive timeline, Mihiraa, but the duration of side effects can be quite variable and really depends on the individual. It's different for every person. What I can outline for you is our plan for managing your symptoms throughout this entire treatment cycle. We will be continuously monitoring you, both here and when you are at home. We ask that you keep a simple chart of your symptoms, their severity, and their timing. This information is incredibly valuable because it allows us to adjust your supportive medications, potentially changing the type, dose, or timing to find what works best for you.
That sounds thorough, but it still feels a bit overwhelming. I'm worried about how I'll cope at home.
It's completely understandable to feel overwhelmed, and I want to take a moment to reassure you that what you're feeling, while undoubtedly difficult, is a very normal part of this process. We expect these side effects, and because we expect them, we have a comprehensive and well-practiced plan to help you manage them every step of the way. You are not alone in this. We have a range of effective medications available to directly tackle symptoms like nausea, and we will work with you to find the right one and the right timing that brings you the most relief. Beyond medication, we can also provide guidance on practical strategies, such as adjusting the timing of your meals to have smaller, more frequent snacks instead of 3 large ones, which can be easier on your stomach. We can also discuss specific dietary adjustments, like which foods might be more soothing and nourishing for you right now. Most importantly, this isn't a static plan. Your doctor will regularly review your overall progress and your side effects, and we will adjust this supportive care plan as needed. So please remember, managing these side effects is not a sign that something is wrong. It is a standard and integral part of your treatment journey, and our entire team is here to support you through it.
That's reassuring to hear.
Speaking of support, would you like me to contact a family member or a support person for you? I can update them on your status, arrange a convenient pickup time for later, or provide them with information on what to expect when you get home so they can best support you.
Yes, could you please call my husband, Russell? His number is in my file. That would be a big help.
Sure, Earl. And Mihiraa, I'd like to ask if you have any other concerns or symptoms you've noticed, even if they seem small. Sometimes things like mouth sores, unusual fatigue, or any new aches and pains can appear, and it's important we know about them to help you manage them effectively.
Yes, now that you mention it, I have been getting a few little sores in my mouth, and the fatigue is just crushing.
Thank you for telling me that. It's crucial that we know about all your symptoms, not just the nausea. I will make a detailed note about the mouth sores and the level of fatigue you're experiencing. While I'm addressing the nausea and these new concerns, Mihiraa, would you like me to also check in with a doctor to get some specific dietary recommendations for you to follow after your treatment today to help keep your strength up?
Yes, please, Charles. I would really appreciate that. Thank you for taking the time to explain everything.
It's my absolute pleasure, Mihiraa. My job is to be your partner in this. So just to make sure we're completely aligned and you feel informed about what happens next, let me recap our plan. My immediate priority is your comfort, so I'm going to prepare and administer that anti-nausea medication through your 4 now to help settle that queasy feeling. Right after that, my next step will be to call your husband, Rohan, to update him on how you're doing, reassure him that you're in good hands, and coordinate a pickup time for later. I will also make it a point to speak directly with a doctor about the other symptoms you mentioned, specifically the mouth sores and the fatigue, as well as get those tailored dietary recommendations for you to try at home. While I'm taking care of all that, the very best thing you can do for yourself is to try and rest. Just allow the medication to do its work. I will personally check back in on you in a little while to see how you're feeling and to share any updates. With all that in mind, and before I step away to get everything started, please, is there anything else at all on your mind or any other question I can answer for you?
No, that's everything for now.
So, Mihiraa, can I have your consent to administer anti-nausea medication?
Sure, you may please.
Thank you, Mihiraa.